So let's continue with lesson 10, the amniotic fluid. So the amniotic fluid physiology and composition class. So take note of this. So the amniotic fluid class is found in the amnion. This is a membranous sac surrounding the fetus. The fluid within the sac class is known as your amniotic fluid. Now the volume, let's talk about the volume class. Now this is regulated. The fluid is regulated by the balance of maternal circulation. When you say maternal circulation, we're talking about the mother's blood, the fetal urine, and lung fluid. Fetal lung fluid. Now, the amniotic fluid is formed from the placenta and has the same composition to that of maternal plasma, with a small number of cells from the skin, urinary tract, digestive tract of the fetus. So the amniotic fluid glass is similar to your maternal plasma or your plasma. So if it's similar with your plasma, it would also have glucose, it would have also have proteins and other electrolytes and substances. Now, during the first trimester, approximately 35 ml of amniotic fluid is derived from maternal circulation or maternal blood. So remember that first trimester, 35 ml amniotic fluid from maternal blood. Now it would increase throughout the pregnancy, reaching a peak of approximately 800 to 1200 ml during the third trimester. So during the third trimester class, it would reach a maximum volume of 800 to 1200 ml. The reason for that class is because your amniotic fluid is now being mixed with fetal urine, and then it would decrease before delivery. Now, after the first trimester, fetal urine class is the major contributor to amniotic fluid volume. So after first trimester, so second trimester, third trimester class, the major composition of your amniotic fluid is fetal urine. This change corresponds to the increased production of creatinine at about 36 weeks of gestation. In order to avoid overflow of fetal urine, fetal swallowing of the amniotic fluid starts after the first trimester as a regulatory process. So fetal swallowing class is the one that would control or regulate the volume of the amniotic fluid. Every time the fetus urinates, it is swallowed back in order to maintain the normal amount of amniotic fluid volume. So imagine that class nung fetus kayo, every time you would urinate, every time we would urinate nung fetus tayo class, we would swallow it back. And then that's how you would maintain amniotic fluid. So the normal value class before delivery at the third trimester, 800 to 1200 ml. Now there is a condition class known as your polyhydramnios. Polyhydramnios class occurs when your amniotic fluid exceeds 1200 ml. Now this signifies the failure of the fetus to begin swallowing and an indication of fetal distress, often associated with your neural tubular disorders or your neural tube disorders, structural chromosomal abnormalities, cardiac arrhythmia, and infection. Then another disorder is your oligohydramnios. This is when the amniotic fluid is less than 800 ml. Usually it indicates increased fetal swallowing, urinary tract deformities, and amniotic membrane leakage. This is seen in cases of umbilical cord compression, fetal fluid. Now, lung fluid class adds what we call lung surfactants to amniotic fluid. Ano ba itong mga lung surfactants na to? So, later explain ko yan. So, lung surfactant is detected within the amniotic fluid and is used as a measure of lung maturity. So, lung surfactant class is basically what you would use or what doctors would use to identify if the lungs of the baby or lungs of the fetus are mature, thus allowing a normal delivery. So ano yung mga lung surfactants class? There are three here: lecithin, your sphingomyelin, and your phosphatidyl glycerol. Now let's talk about the functions of the amniotic fluid. So it would cushion and protect the developing fetus, serve as a key role in the exchange of water and molecules between the fetus and maternal circulation, stabilizes the temperature to protect the fetus from extreme temperature changes, permits proper lung development, allows movement of the fetus. So as mentioned again, class, your fetus is enclosed in what we call an amnion sac. The placenta, class, is the organ responsible for nourishing and protecting the fetus. So ito yung placenta niyo. This is the one that would nourish and protect the fetus. It would perform myriad functions such as supporting fetal development, facilitate blood flow, gas exchange, waste elimination, and acts as a protective barrier. Connected through the umbilical cord to the fetus. So yung umbilical cord, class, ito siya. So here's your placenta. It would connect to the fetus using an umbilical cord. So umbilical cord is the way to transfer glucose, antibodies, and essential substances for fetal development. Then again, amniotic fluid is the fluid within the amniotic sac. Then we have your amnion. This is the membranous sac which would envelope the fetus. So ito yung amnion nyo, class. Itong layer na to. This is the one enveloping the fetus. Inside the amnion is your amniotic cavity. And inside this amniotic cavity, you would find your amniotic fluid. Then we have your chorion. Chorion, class, is the outermost membrane that encloses the amnion containing the fetus. So ito naman yung chorion nyo, class. Chorion is the one enclosing the amnion. So siya yung nagpo-protect sa amnion. Both amnion, class, and chorion are composed of the outer mesoderm and inner ectoderm. Now let's talk about its chemical composition, class. So your amniotic fluid would contain the following: bilirubin, lipids, enzymes, electrolytes, urea, creatinine, and uric acid, proteins, and hormones. Since the majority of your amniotic fluid, class, is made up of fetal urine, you would expect, class, the presence of your urea and your creatinine. Now, fetal urine, class, increases creatinine, urea, and even uric acid. So what the purpose here, the major purpose of creatinine here, class, is that it is used. Creatinine is used to assess or estimate fetal age. So if the babies are, if the amniotic creatinine, if the amniotic fluid creatinine is between 1.5 to 2 milligram per DL, the fetal age is less than 36 weeks. If the amniotic fluid creatinine is greater than 2 milligram per DL, the fetal age is greater than 36 weeks. Now let's talk about the specimen collection and handling. So the way or the technique or the procedure done in collecting amniotic fluid, class, is what we call amniocentesis. This is needle aspiration of fluid from the amniotic sac, performed as early as 16 weeks of gestation. Collection of amniotic fluid is termed as amniocentesis and relatively safe after the 14th week of gestation. So you would do this, class. Doctors would do this on the start of the second trimester. 'Di ba sa isang buwan, class, in 1 month there are 4 weeks. So ang isang trimester is made up of 12 weeks. So if it's on the 14th week, so amniocentesis is safe starting from the 14th week onwards. So remember that. So the needle is injected transabdominally through the amnion sac with simultaneous use of an ultrasound. Now, second trimester amniocentesis, class, is done for chromosome analysis, usually at the 16th week of gestation, and would test for intrauterine growth retardation. Then for third trimester amniocentesis is done class to test for fetal distress and maturity. Take note class that the maximum volume of amniotic fluid collected is 30 ml. The first 2 or 3 ml are contaminated by maternal blood, tissue fluid cells, and thus they need to be discarded. So these are the indications class for performing amniocentesis. So take note of them. So amniocentesis may be done at 15 to 18 weeks following the different conditions to determine treatment or intervention. So if the mother's age is 35 years old or older, family history of Down syndrome or yung trisomy 21 and other chromosome abnormalities. Parents carry an abnormal chromosome rearrangement, earlier pregnancy or child with birth defect, parent is a carrier of a metabolic disorder, family history of different genetic diseases class, elevated maternal serum alpha fetoprotein, abnormal triple marker screening tests, previous child with a neural tube disorder, such as spina bifida or ventral wall defects, gastrocytosis, 3 or more miscarriages. Amniocentesis is indicated later in the pregnancy, 20 to 42 weeks, to evaluate fetal lung maturity, fetal distress, HDN caused by Rh blood type incompatibility, and infection. Now let's talk about their processing class. So fluid for bilirubin analysis is done class in cases of hemolytic disease of the newborn. So later explain ko yan. When you collect your fluid class, amniotic fluid for bilirubin analysis, you must use amber tubes or black plastic covers. The reason class is that your light oxidizes bilirubin. So this would lead to a falsely decrease bilirubin. So you need to protect it from light by using amber tubes or black plastic cover. Then if you're going to test for phospholipid analysis, you need to transport it on ice and centrifuge at 500 Gs and 500 G and class. And the supernatant must be saved for testing. Then fluid for cytological testing and bacterial culture must be stored at body temp to keep fetal cells alive. So if it's body temp, 37 degrees, it would prolong the cell life. Then for chromosomal abnormalities as well. Then fluid for chemical analysis must be stored for any length of time and centrifuge. If testing delays for more than 24 hours, the fluid should be kept frozen. Now, when do you do your amniocentesis class? So you would use it primarily to detect neural tube defects. So abnormal screening blood tests increase in the blood specimen of the mother if there is fetal distress. So if there is fetal distress class, if the baby is suffering from fetal distress, the following would be increased in the blood of the mother. So blood of the mother to ha. So the following will be increased in the blood of the mother if there is fetal distress, maternal AFP, HCG, and unconjugated estriol. Then you would also do amniocentesis for abnormal chromosome analysis or familial history of genetic disorder. Then you would do fetal body measurement to evaluate the health of the fetus through the aid of an ultrasound. Then biochemical substances that the fetus produce can be analyzed to routine layer chromatography. Then possible early delivery class. So for a possible early delivery, you need to check if the disease has a normal FLM, suffering from HDN, or infection. Then collection of fetal epithelial cells in amniotic fluid indicate the genetic material of the fetus examined for chromosomal abnormalities. So you would do amniocentesis class to collect epithelial cells, fetal epithelial cells, and these fetal epithelial cells class are examined, uh, are checked. Their chromosomes are checked via what we call karyotyping, FISH or your fluorescent in situ hybridization, fluorescent mapping, spectral karyotyping, and DNA testing. So ito yung mga methods class to detect. These are the different methods to detect chromosomal abnormalities using fetal epithelial cell karyotyping, FISH, fluorescent mapping, spectral karyotyping, and DNA testing. Now, there are cases, class, wherein the physician would puncture the maternal bladder instead of the amniotic sac. So you need to be able to differentiate between amniotic fluid and maternal urine. To do this, one test that you could do, class, is the so-called Fern test. So this would use to evaluate premature rupture of the membrane. In the Fern test, a vaginal fluid specimen is spread on a glass slide and allowed to completely air dry at room temp. Now, once it's air dry glass, you would view it under a microscope and you would look for the presence of fern-like crystals. So if you take a look at the picture, ayan yung itsura ng fern. Nakakita na kayo ng fern na halaman, di ba, class? These are amniotic fluid crystals. The reason why there are fern crystals, class, is due to the protein and sodium chloride content, which is a positive screening for amniotic fluid. Absence of this fern crystals, class, would indicate that the sample is maternal urine. You could also use other test class such as urea, creatinine, glucose, and protein. Among the four, urea, creatinine are the reliable tests. So urea would be less than 30 milligram in amniotic fluid, greater than 300 milligram in maternal urine. For creatinine, it would be less than 3.5 milligram per DL, and if it's maternal urine, greater than 10 milligram per DL. The less reliable naman, class, are glucose and protein. So amniotic fluid, positive sa amniotic fluid. Si glucose, negative in maternal urine. But again, this is less reliable. What if the mother, class, is diabetic? So if the mother is diabetic, there's a possibility that maternal urine would also be positive for glucose. Then for protein, positive for for amniotic fluid, negative for maternal urine. But again, if the patient has high protein content seen in urinary tract infection, or if the patient is suffering from kidney disorders, this could also be positive. So that's the reason why it's less reliable, class. Then physical analysis, class. So here are the physical analysis. So your amniotic fluid, the normal color is colorless. If the amniotic fluid is blood streak, this could be traumatic top, abdominal trauma, or intraamniotic hemorrhage. If the amniotic fluid is yellow, it would be caused by hemolytic disease of the newborn. If it's dark green, there's the so-called meconium. And if it's dark red brown, it's a sign that there is fetal death. So yellow color indicates the presence of bilirubin, class, due to RBC hemolysis seen in HDN. Then meconium, class, yung dark green ng amniotic fluid is due to the meconium. Meconium, class, is the baby's first stool or bowel movement. It is a dark green, sticky substance made up of cells, protein, intestinal secretions, and bile. Now, there are cases, class, wherein the amniotic fluid would be contaminated with maternal RBCs seen in traumatic top and such. So you would need to do what we call a Kleihauer-Betke test. Kleihauer-Betke test, class, is used to differentiate fetal RBC from maternal RBCs in a red amniotic fluid. So what you would be doing, class, is you're going to create a peripheral blood smear made from the antibiotic amniotic fluid and treated with acid. So what happens here is that fetal cells would remain intact because of high concentration of HbF. HbF class would stand for fetal hemoglobin. So the fetal cells would remain intact because of high fetal hemoglobin. Now, the fetal cells are immature and are resistant to acid. So they would still be whole, buo pa rin sila class because of their resistance to acid. While the maternal cells naman class would become ghost cells because they contain HbA. HbA would stand for adult hemoglobin, which is eluted from the RBC. Now, maternal cells are mature and sensitive to acid. So, what happens is that they would lyse and the hemoglobin would be released, forming the so called ghost cell. Majority are HbA. This would be caused by maternal trauma or accident. But if the majority are HbF class, this is a sign of membrane leakage in the fetus or there is a problem in the fetus. So itong mga blue arrow na to class, these are your fetal cells. Again, they are resistant to acid, thus they would still be whole because of their presence of fetal hemoglobin. Well, ito namang mga red arrows na to showing cells that are hollow or clear. These are your maternal cells. Ang mga RBCs na yan, those RBCs class are termed as ghost cells. They are sensitive to acid, thus, when they are exposed to acid, the hemoglobin A or the adult hemoglobin would be released, forming the ghost cells. If there is increased maternal cells, it's a sign of maternal trauma or accident. But if there are increased fetal cells, then there's a problem or there's a membrane leakage in the fetus. Now we have your test for hemolytic disease of the newborn. Now HDN is also known as your erythroblastosis fetalis or the spontaneous lysis of RBC of fetus. Now, for you to understand this class, let's have a quick discussion lang about blood types. I know you're familiar class that there are four blood types. We have your A, B, AB, and O. Now, this blood type is based on what we call the ABO blood group. Now, aside from the ABO blood group in your third year, you will learn about other blood groups. And there's what we call a very important blood group system known as your RH group system. It's either you are RH positive or RH negative. Kaya nga pag nag-check kayo ng blood type, you would be A positive, A negative, B positive, B negative, AB positive, B negative. Now, let's just focus on the RH. If you are RH positive class, you have the so-called RH antigen on the surface of your RBC. And you would have no anti-RH antibody. So remember that. Let me repeat class. If you are RH positive, you have an RH antigen on the surface of your RBC. These RH antigen class are like receptors that are used by certain immune system, certain antibodies or the immune system to identify a cell. Now, yung RH negative naman, if you are an RH negative class, you have no RH antigen, but you would have anti RH antibody. Specifically, yung anti-RH antibody na yan is the so-called anti-D antibody. So, clear tayo dyan, ha? Now, what happens here, class, is that during the first pregnancy, halimbawa, a couple got married and they got pregnant. Now, yung the father is RH positive. The mother is Rh negative. So again, kapag Rh positive ka, you have the Rh antigen, no Rh antibody. Kapag mother ka Rh negative, you would have no Rh antigen but you have an antibody. Now what happens in this scenario class is yung baby, yung first child. If the first child class becomes Rh positive, ulitin natin kapag Rh positive, again, meron siyang Rh antigen, no antibody. Si mother mo ngayon, yung mother class na Rh negative nyo, has no antigen but has an Rh antibody. What happens here, because the first child class is Rh positive, this will now cause the exposure of the Rh antigen to the mother's Rh antibody. And because of that class, antibodies, anti, sorry, anti-Rh antibodies are now present, are now present in the mother's circulation. Now, si mother class binuntis ulit. So, after a few years, binuntis na ulit siya nung tatay. They now have their second child. Sa second child class, si second child is again Rh positive. Now, because the mother has the anti-Rh antibody in its circulation, the antibodies will now attack the Rh antigen of the second born, now causing hemolysis and other disorders. So yun yung HDN class. Basically, the mother's antibodies attack the fetal cells or the fetal RBC antigen. Now, this is the most commonly found with fetuses of Rh negative mother. Other RBC antigens can also cause HDN, such as your ABO class. But this is a milder type. Now, fetal cells with antigens would enter the maternal circulation and cause the production of maternal antibodies. Maternal antibodies would cross the placenta and destroy the fetal cells with their corresponding antigen. Now, the test for HDN class, so we have the most common, yung amniotic fluid bilirubin test. This is the oldest performed test on amniotic fluid, na hindi na siya masyado ginagawa class actually. Unconjugated bilirubin amount correlates with the amount of RBC destruction. Once the RBC is sliced, hemoglobin is released, and the heme component is converted to your unconjugated bilirubin or your B1. The fluid is subjected to spectrophotometric analysis between 365 and 150 nanometer and is plotted on a semi-log paper. So OD 450 nanometer class is done for bilirubin scan. OD 410 nanometer is oxyhemoglobin. Now, itong semi-log paper na to is you would be doing a Lilly graph class. So, this graph plots the absorbance difference between normal and patient bilirubin. So, yung x-axis class, you have the absorbance of the A450. Yung y-axis is yung patient bilirubin, normal and against gestational age. The said graph is divided into three zones indicating the severity of hemolysis. So, sorry class yung x-axis niya pala, this is the gestational. So, ito yung x-axis. Yung y-axis naman niya is the normal and patient bilirubin absorbance difference. So, ito siya. Now, zone 1 class, if the value is within this zone 1, it would be a mildly affected fetus. If the value reaches, or if you were able to grab it at zone 2, this is a moderately affecting the fetus. Pero kapag zone 3 naman class, this is severe hemolysis and suggests a severely affected fetus. So the doctor would need to perform induction of labor or forced labor class. or intrauterine exchange transfusion must be considered. So do take note of the lilligram. Hindi ko na ituturo. I will not teach anymore the computation class because this is a very old test. Hindi nyo to gagawin sa laboratory. Let's go to the test for neural tube defects class. So neural tube defects class was not able or is a condition wherein the fetus is not able to form or close properly. It is a structure in a developing embryo that would eventually become the baby's brain, spinal cord, and tissue. So ang case nito class, neural tube defect nyo is related to the neural tube, wherein the neural tube class does not develop or properly close. And in the future, yung neural tube nyo would become the baby's brain, the spinal cord, and the nerve tissue. Now, this condition class is known as your spina bifida. Now, babies with spina bifida class could live but with numerous related problems such as walking and mobility, orthopedic complications, bowel and bladder problems, and accumulation of fluid in the brain. Then another neural tube defect class is known as your anencephaly. Anencephaly naman class is the incomplete development of the brain of the baby. Excuse me. Normally, they do not last 1 hour after delivery. They could be detected class by maternal serum alpha fetoprotein, high resolution ultrasound, and via amniocentesis. So the screening test class for neural tube defect is your AFP, maternal serum AFP. Both serum and amniotic fluid AFP levels are reported in terms of multiples of median or your MOM. Values twice the median value is considered abnormal, meaning class greater than 2 MOM is considered abnormal for both maternal serum and amniotic fluid. So if you're positive for maternal serum AFP class, abnormal yung AFP ng mother, you need to do a confirmatory test. The confirmatory test class is your ACEH or your acetylcholinesterase. This is more specific for neural tube disorder than AFP, provided it is not performed on a bloody specimen, because blood would contain ACHE, causing a falsely positive result. So dapat yung serum or yung sample glass or yung amniotic fluid is not bloody. Now let's first discuss your AFP class. So this is produced by the fetal liver prior to 18 weeks of gestation. Normal is again less than 2 MOM. Normal values are based on the week of gestational age, as the fetus would produce maximal AFP between 12 and 15 weeks of gestation. Increased levels in maternal blood or amniotic fluid indicates anencephaly or spina bifida. If the AFP is increased, then the confirmatory is the detection of acetylcholinesterase or the ACHE. More specific yan class for neural tube defect. If we detect acetylcholinesterase, the fluid must be free from blood, as this can cause false positive result. So on the left picture class, this is an example of spina bifida, wherein yung neural tube niya was not able to properly close or develop. Then on the middle and the right side, you would see a case of anencephaly, wherein the brain did not develop or properly close. Kaya nakalabas yung utak class. And most babies would die 1 hour after delivery. Now there are three types of spina bifida. The first one is your myelomeningocele, now also known as your open spina bifida. So myelomeningocele is an open spina bifida. This is the most severe type, wherein the spinal canal is open class along with several vertebrae. So yung spinal canal, if you take a look, ito siya class. Open siya. This is your myelomeningocele. The membranes and the spinal nerves would push through this opening at birth, forming a sac on the baby's back. So if you take a look at the picture, may sac SAC doon sa likod ng baby class, typically exposing tissues and nerves. This makes the baby prone to life-threatening infection and may cause paralysis, bladder, and bowel dysfunction. It is usually associated with a type 2 Chiari hindbrain malformation, ventriculomegaly, and hydrocephalus. Then we have your meningosol. So meningosol naman class is often described as a less severe variant of myelomeningosol, in which the spinal cord is not found in the sac and is described to be absent of neural matter in its herniated sac. Then you have your spina bifida occulta. Occulta means hidden. It is the mildest class and most common type. Spina bifida occulta results in a smaller separation or gap in one or more of the bones of the spine. Unlike in the more severe form of spina bifida, the spinal cord does not stick out through an opening in the spine. Spina bifida occulta most often causes no health problems, although rarely it can cause back pain or changes in bladder function. So what would you do to detect your spina bifida class? So the first thing you would do for if you are a pregnant mother, if you know of someone who is pregnant, they should be taking folic acid class, especially in their early pregnancy. The reason folic acid class would cause a significantly less chance to have a baby with spina bifida or related neural tube defect. So ang ideal class talaga folic acid, vitamin B12 would also help. Now, possible maternal risk factors class for spina bifida would include diabetes mellitus, obesity, exposure to high heat such as fever, or use of a hot tub or sauna in early pregnancy. Use of certain anti-seizure medications during pregnancy. So ito yung mga risk factors. If you're diabetic, if you're obese, if you like going to hot tubs or sauna class, and if you take anti-seizure medications. Now, the test for spina bifida is usually via ultrasound. So fetal ultrasound class is the most accurate method to diagnose spina bifida. Ultrasound can be performed during the first trimester, 11 to 14 weeks, and second trimester, 18 to 22 weeks. That is why, class, in pregnant women, it's very important that pregnant mothers or pregnant women would have a monthly ultrasound so that they would be able to identify at an early time if the baby or if the fetus has neural tube defects and other malformities or abnormalities. Now, what is the treatment of spina bifida class? So, surgery before birth. Prenatal surgery for spina bifida takes place before the 26th week of pregnancy. Surgeons expose the pregnant mother's uterus surgically, opening the uterus and would repair the baby's spinal cord. Fetal surgery class would also reduce the risk of hydrocephalus. Then cesarean birth. Many babies with myelomeningosol tend to be in a feet first breech position. So, di ba kapag manganganak ang mother class, yung fetus would be on a head first position. So, in some cases, they need to undergo, if positive siya sa myelomeningosol, the baby needs to be is in a feet first position. So, because it's in a feet first position, the mode of uh, labor class or the mode of delivery would be cesarean. Then surgery after birth, myelomeningosol requires surgery. Performing the surgery early can help minimize the risk of infection. It may also help protect the spinal cord from more trauma. During the procedure, a neurosurgeon places the spinal cord and exposed tissue inside the baby's body and covers them with muscle and skin. At the same time, the neurosurgeon may place a shunt in the baby's brain to control hydrocephalus. Then the last group of disorder class is yung respiratory distress syndrome. So respiratory distress syndrome class would usually involve the fetal lungs. This is the most frequent complication of early delivery and is the seventh most common cause of morbidity and mortality in a premature infant. This is caused by the insufficiency class of lung surfactant that allows the alveoli to remain open throughout inhalation and exhalation. So lung surfactants class prevent the alveoli from collapsing by decreasing surface tension and allowing them to inflate with air more easily. Now the lung surfactants class is a sign that fetal lung is immature and the baby should not be delivered. Lab testing for assessing fetal lung maturity would include the LS ratio or the lecithin sphingomyelin ratio, the amniostat film phosphatidylglycerol, the foam shake test, the lamellar body count, and the microviscosity fluorescent polarization immunoassay. So let's start first with the LS ratio. LS ratio class is the reference method for fetal lung maturity. Lecithin is the primary component of the surfactant that would account for alveolar stability. Increased production occurs after the 35th week, while your sphingomyelin class could serve as a control onto which the base in which to base the rise in lecithin. It is also a lipid produced at a constant rate after the 26th week. If the LS ratio reaches 2 or higher class, a preterm delivery is considered a safe procedure. So early delivery class, meaning less than 9 months, is considered safe provided class that the LS ratio reaches 2 or higher. Otherwise, if the value does not reach the ratio of 2, falsely elevated results in fluid contaminated with blood or meconium is expected. So you would have falsely elevated LS ratio class if the amniotic fluid is contaminated or mixed with blood or meconium. LS ratio is 1.6 prior to week 35. So less than 35 weeks class, nasa 1.6 siya. But after the 35th week class, it would now become 2.0. Many laboratories class have replaced the LS ratio with quantitative phosphatidylglycerol immunoassay and lamellar body density procedures. Now let's go to the second test, yung amniostat FLM phosphatidylglycerol. So this is an immunological agglutination test for phosphatidylglycerol. Production of the surfactant phosphatidylglycerol normally parallels that of lecithin. So sabay sila class ni lecithin in their production amount, in the amount that being produced. In amniostat FLM, it uses antibody against phosphatidylglycerol. This antibody will cause agglutination, and this is considered the positive result for amniostat FLM. Then we have your foam shake test. So foam shake test class is a qualitative test to assess fetal lung maturity. This is performed at the bedside. Continuous line of bubbles around the outside edge indicates the presence of a sufficient amount of surfactant to maintain alveolar stability. So ito yung procedure niya, class. Do memorize them. Then another test is your foam stability index. So memorize also. So greater than 47 FSI class indicates fetal lung maturity. Then we have your lamellar body count. So lamellar bodies class are densely packed layers of phospholipid that represent a storage form of pulmonary surfactant. They are secreted by the type 2 pneumocyte. Lamellar body count can be obtained using the platelet channel of an automated hematology analyzer using either optical or impedance method. The count must exceed 32,000 per UL to represent adequate fetal lung maturity. So the normal value of your lamellar body's class is greater than 32 thousandths per UL. This would indicate safe preterm delivery, indicates mature fetal lungs. Then we have the last test, yung microviscosity fluorescence polarization immunoassay. This is the most widely used in evaluating FLM. It was considered an excellent screening tool for FLM because the results correlated well with an LS ratio of 2.0. But this is no longer done class kasi yung supplier nito is no longer creating reagents for the test based on the principle that phospholipids decrease the microviscosity of the amniotic fluid. This is the summary of the tests in your amniotic fluid class. Do memorize them. They will definitely come out in your quiz. So yan din yung diniscuss ko kanina class. Take note of the microviscosity ha. Normal value is greater than or equal to 55 milligram per G. Fetal lung maturity. So here are the references. So that ends your lesson 10 amniotic fluid. Thank you.